Dan Delmar, Robin Flynn in for Aaron. It is, of course, a breaking news day here at CJAD, and we'll get back to the phone lines in a few minutes with callers from all around the city. If you're stuck in traffic, if you're in water, I know some people, at least about a dozen cars, I think, were lost under underpasses. Do give us a call, 514-790-0800, 790-0800. For now, though, back to other news items, and it's a very, very busy day. We've had the encampment at McGill dismantled. There's breaking news now that the Canadian government, Justin Trudeau, the Prime Minister, announcing that he is on track to, at least has a plan to meet the NATO defense targets. An announcement is imminent out of the NATO summit. Also here in Quebec on the healthcare front, we're seeing a dramatic rise in the number of cases of whooping cough being diagnosed and some concerns over COVID as well. Dr. Luc Boileau is Quebec's Public Health Director and joins us now. Dr. Boileau, good evening.
Good evening.
Thanks for joining us. On a lighter note first, for those that are stuck in Montreal traffic, do you have any good meditation relaxation tips handy?
That's a good one. I would like to have those because I'm running from Quebec City to Montreal, so I hope that it will be nicer over there than it seems to be right now. I should be there in about 4 hours, so let's hope.
Yeah, do give yourself extra time.
Yeah, avoid the 40 when you get here.
Okay.
Right now, we're seeing this huge increase in whooping cough cases. And when I say huge, I mean like it's significant. Last year, we had only seen 106 cases, the year before 44, whereas the Quebec Health Ministry has documented over 6,000 cases already since the start of the year. Is this normal to have an increase like this? I mean, that seems like a very, very drastic increase.
It's not normal to have so many cases, but it's normal to have cycles of few years between normally around 4 or 5 years that we will experience more of those cases. But recently we had COVID, so the population was greatly protected for the circulation of any type of virus, which is not the case now. It's a bacteria, and they were well protected. So that explains the fact that since 2018, 2019, that was our last increase, but it was not a strong one. We have to really get a few years earlier. So this explains those numbers right now. The other thing is that we are much more capable of diagnosing those diseases because we have the technology now very spread all around the hospitals in Quebec. So that might explain also the capacity of finding those cases. But in fact, it's a serious situation, and unfortunately a lot of people, and namely kids between 10, 14, sometimes even between 14 and 19, but most of our cases are between 10 and 14 will experience those unfortunate disease, which evaluate normally very well, even though it's difficult when we have to face it, but it's treatable and it's okay.
What are some signs that it could just not be a regular cough and it might be whooping cough, and when should parents seek attention?
For the first days, it will look like any syndromic of the flu or other viruses infections. So you will have a little bit of coughing. The eyes will be itching, and your nose will have some drops, and you might have fever, of course. But then after, you will develop a cough that will be significantly remarkable, which is a tough one. This is why we call it in French coqueluche. It comes from the chicken, and so it's whooping cough. It's very it's recognizable, and it's sometimes dramatic for the kids that are coughing a lot and a lot and a lot, and they even have trouble to breathe through that. But it's treatable, and it will be okay after, let's say, 5 days of treatment, but the coughing might continue for many days and sometimes for a couple of weeks or a few weeks. But during that time, they won't be contagious. The most important for us is to protect the very young kids, so the one be under 1 year old or mostly 6 years old. And this is why we are vaccinating the kids at 2 months, 4 months, and 1 year. And we are also inviting all the pregnant women to be vaccinated nearly the end of their pregnancy or in the middle of it at 26, 28 weeks of pregnancy, because they will protect their baby for the few first weeks of their life. And this has been dramatically positive for our population, because we had very few cases of young kids with this disease right now. Even though the numbers are very high, there is still very, very low number of cases for very young baby.
Okay. Speaking of vaccines, there's also an increase in COVID cases, it seems. We got confirmation from the Montreal General Hospital that they have an outbreak of COVID on the 18th floor there. Are you seeing an increase in cases overall in the province of Quebec? And what can people do to protect themselves? I thought I read that the current vaccine that we have for COVID isn't protecting you against the newer strains that we're seeing. Is that true?
Not necessarily. It is protective, but not as strong as it was for the other variants that we had before. So this is why we are not calling any of the population right now to go and be vaccinated. We'll wait for those recommendations with the new vaccine that might come at the end of summer or beginning of autumn. That will be more reliable for those variants that are in progress right now, which are in the declination of the one that we had during the last few months, which is the JN1. So there's now a number different, which is the KP3. But in fact, the fact that we have been protected for the COVID with the vaccination and the COVID for experience that a lot of us had will be, of course, something very positive to be confronted to this variant right now. So this is why a lot of people are not necessitated. They do not have to get to the hospital and be hospitalized, and it's not dramatic for them. But unfortunately, when you are older, the risk of developing a COVID that might be tougher is greater, and this is why we already have vaccinated our people in the long-term care facilities and residence for elderly people, but that has been done in May and June, and we are now waiting for the new vaccine to come up. And to answer to your question, this is true. We have much more cases than we had a few weeks ago, at least double of size for hospitalization, and the positivity of the tests are moving up, which is something that we expected with the arrival of any new variant. But this one is disturbing because he's getting higher and higher, but we are not expecting, even though it's coming up, to be confronted to the very important wave, because the people have been vaccinated so far in the past. They had a lot of them experience the COVID, and this is why we expect it to get higher for our hospitalization, but not as much as we had known before, and you do remember that, so we're not in that perspective right now.
Dr. Boileau, sorry to rush you. We're out of time basically, but very quickly, please. When do we have the mass release of the new vaccine, which covers the new strains as well?
It is most probably during September or beginning of October. This is our expectancy. We are not confirming it. We are waiting for the industry to propose us the new vaccine at the federal level to be homologated, which has not been done so far. So we're really hoping to have this at the end of the summer, but we have to wait to confirm that.
Dr. Luc Boileau, Quebec Public Health Director, thank you so much.
Thank you very much and have a great day. Thanks.